The Pleur-evac Mini-Sahara chest drainage system is a sterile, non-pyrogenic unit intended for single use. It consists of a dry suction control to 40 centimeters of water, internal one-way valve, patient pressure gauge, air leak meter for diagnostics, 500 cc collection chamber, a carrying strap, and the same 3 integral safety valves as the Pleur-evac Sahara S-0500-08LF adult or pediatric system. To begin setup, activate the floor stand at the bottom of the unit and lock it in place. Remove the aseptic cap cover from the end of the patient tube and connect the patient tube to the thoracic catheter. Note, when this connection is made, the patient is protected from atmospheric air entry and can expel air through the one-way valve located in the Pleur-evac unit. Drainage, if any, will migrate into the collection chamber. A sterile pre-filled syringe is enclosed. Remove the syringe. Insert the syringe through the injection site on the back of the unit, then depress the syringe and insert all fluid. Once the fluid is injected, the water will turn blue to facilitate diagnostics. Do not inject fluid in the suction port. If gravity drainage, no suction, then the suction port should remain uncapped and free of obstructions. If suction is required, rotate the dial to 20 centimeters or as instructed. Confirm that wall source suction is off. Connect the suction source to the suction port using suction tubing. No water is needed for suction control. Turn wall suction on and slowly adjust wall suction setting until the desired level appears in the patient pressure gauge window. This window is seen as bellows with negative pressure expressed in increments of 10 for each white line extended. The suction level is determined by the position of the dial on the dry suction control and wall suction. The suction level is displayed by the position of the gauge in the patient pressure window. After suction is applied, the gauge appears in the patient pressure gauge window. When changing from a higher suction setting to a lower setting, the negativity on the patient side of the seal may remain at higher level unless negative pressure is relieved by using the manual high negativity relief valve. Check the unit periodically to ensure adequate suction is being applied to the unit and that the indicator in the patient pressure gauge window is at the desired level. The one-way valve provides a one-way seal which allows air to escape from the patient while retarding the reverse flow of air. Water is not required to establish the seal. The positive pressure valve opens automatically with an increase in positive pressure, preventing pressure accumulation and a potential pneumothorax. It is next to the suction port, and air will escape if there is an occlusion in the suction tubing. Do not obstruct the positive pressure relief valve. The automatic high negativity release valve is located in the rear center of the unit and will automatically open at approximately -50 centimeters of water, providing protection against excessive negative pressure buildup. The manual filtered high negativity relief valve is provided to manually vent excessive negative pressure. Note the fluid level in the small arm of the seal. Depress the high negativity valve to vent negative pressure. Filtered air will enter the unit and the fluid level in the seal will drop. Release the button when the desired level of negativity is attained. Caution: if suction is not operative or on gravity drainage, depressing the high negativity release valve can reduce negative pressure to 0 or atmosphere, with the resulting possibility of a pneumothorax. The collection chamber has a capacity of 500 cc's, with increments of measure in 2 cc increments to 180 and 10 cc's to capacity. Replace the unit when drainage reaches 500 cc's. Rotate the red and blue connector to where connector is in the down or inverted position. Use a standard lure lock syringe for withdrawing samples. No needle is required. A needleless sample port is available on the back of the unit. Prepare the second unit according to setup instructions and place it next to the original Pleur-evac unit. Separate the red and blue connectors on second Pleur-evac unit. Clamp the patient tube on the original Pleur-evac unit. Separate the red and blue connectors on the original Pleur-evac unit, keeping the original tubing from the red connector to the patient. Attach the blue connector of the second Pleur-evac unit to the red connector on the original patient tube. Reconnect the suction tubing to new unit. Open the clamp on the original patient tube. After noting the fluid level, discard the original Pleur-evac unit per hospital-approved aseptic guidelines. The patient tube is approximately 3 feet in length for ambulation. There is a second, sterile 3-foot section in the package. This can be inserted via connectors to construct a 6-foot section that will extend from the bed to the floor. There is a carrying bag with a removable strap. Remove the strap from carrying bag. Insert the Pleur-evac unit into bag. For shoulder placement, slide the buckle through the slots on the back. For waist placement, slide the buckle through the slots on back of the bag. Adjust the height. 2 hangers are provided for use with a bed, stand, or stretcher.